if you imagine that COVID 19 was actually as lethal as we were told, and that the vaccine was the only thing that could have saved lives, only 2% of Africa got vaccines. They would have decimated
Yeah.
Africa because they did not have access to the resources. Any thoughts about that? How, I mean, in the sense of equitable distribution, it's a good idea, but is it practical?
It's not, it wouldn't have helped also, because Africa, it was, the virus was not killing, it was the obesity which was killing. And it was the population naivety, I would say, like Africa, Asia, they are very crowded countries. So they are exposed to different coronaviruses, so there was some element of cross immunity can be thought of. And vaccine in Africa also, if you take, South Africa had the highest vaccination rate in Africa, but it had the higher mortality also, because the South Africa obesity was 3 times more than the other African countries. So the if you see, after 3 years, if I have been tabulating data, I found that whatever difference was before the rollout of the vaccine and after complete vaccination in the developed countries, and much less vaccination in Africa and to some extent Asia, the mortality differences remained the same. The 10 times more in Western compared to Asian, 20 times more compared to African continent. So whatever measures were taken at huge cost and perhaps benefit to pharma, they did not have much impact on the course of the pandemic, which was a more or less went its natural course, and it affected the vulnerable, particularly people with comorbidities and obesity and age, of course, age. So this
Mm,
data, we were getting the data, we were not getting age stratified data of mortality, morbidity, and similarly for the post vaccination also, we should have age stratified data of sudden deaths, which unfortunately, whatever data is available, it shows the younger people are affected more,
mm.
particularly myocarditis and other certain concerning effects.
So, so Amitav, just imagine for a second, you've got a lot of experience, you're an epidemiologist, you've worked across multiple diseases in India. The WHO calls you and says, Professor Banerjee, we want you to lead our organization. What would you do that would be different?
I would have country specific experts. I would definitely have the collaboration and coordination is definitely a good idea, and it should remain collaboration and coordination. What WHO treaty it is trying, it is going for control. Control is a war actually, and war can be, there can be collateral harm. So I, as a epidemiologist, I would like to consult the regional epidemiologist, discuss with them, and each country would may have a different strategy for a particular pandemic. The same pandemic behaves in a different way according to demographics, according to population density. Like in India, we did a lockdown, we increased the transmission because Indian houses are very crowded. So that this does not work, the same thing will not work. So one has to do I would go around like a grandmaster who is looking at number of chess boards, and different chess boards simultaneously play. Big grandmasters, they play against 20, 30 players simultaneously. They don't play the same moves in every board. Every board, the positions, the chess pieces are same, but the game rules are same. Similarly, virus may be there, everything may be same, but each virus may behave like a game of chess. So epidemiology is as complex or more complex than a game of chess. So I would look at the different chess boards or different countries and consult the local grandmaster there, and accordingly with collaboration, the strategy would be tailor made to that country, to the in that country. Like India is a very vast country with different climate, different population, different social status. So even in the same country, the strategy may be different at the regional level. So that one size fits all will not work, and it can harm more than it can work.
So these are important points, Amitav. And one of the questions that I'm reflecting on, and I was asked to ask you this question, and I want you to think about this. Politicians are all about power and control. What would make politicians across the world give up that degree of control in terms of a pandemic to an international organization? I really am baffled by the fact that across the world, the politicians are going along with this. From experience or from observation, they usually have to be given something for that to happen. Any thoughts?